Okay, so the first presentation we have, the only presentation actually, this afternoon is from Thomas Sendor and Martina Vosteen from Ramboll Environ. And they've kindly agreed to share their opening thoughts on how to prepare an application for authorization from a risk-based approach for these substances. So thank you very much for agreeing to talk to us today. And the floor is yours. Thank you.
Thank you, Mr. Chairman. Yeah, we are Ramboll Environ, a consultancy who came into the position of developing such an approach as presented here by entrustment by a group of pharmaceutical companies who use this substance, the ethoxylated octyl phenol, and therefore are faced with the need to authorize the substance. As my fellow presenters already alluded to, there is currently no real risk assessment. There is no agreement on a threshold or a PNEC, and the industry itself is responsible for developing such an approach, and that's what we are now trying to establish on behalf of the industry. A further point during this introduction, I want to thank first of all ECHA for inviting us to present here, and also to thank them to set up the whole agenda so that every presentation builds up on the other one. My previous presenters have already set the scene, and I want to thank them for this also. This relieves some pressure from me for presenting the nature of the substance and the data set that is already there in the regulatory community and the previous assessments. So I can actually skip or abbreviate some of my slides. On the other hand, I have to say I already have to disappoint you at this point in time because my presentation is not on the decision on a PNEC or a threshold or a value that I could report, because we are still in the process. It's a work in progress. So I'll take you through the journey where we got so far and the steps we have taken and will hopefully take in order to arrive at a conclusion that is satisfactory from a scientific viewpoint and successful with respect to a possible application for authorization. So that's already presented by Enrique. What's the reason for the necessity for deriving a PNEC for the substance? The ethoxylated ethyl phenol is on Annex 14 of REACH, so there is a need. What has occupied quite a lot and still will require some attention is certainly the question, is a threshold identifiable? So can we derive a PNEC? And this will determine if we take the SEA route, so the socioeconomic route, or the adequate control route. And since there is no official reference value available, it is industry's duty to take this route. A brief summary on what Annika already presented. I don't need to repeat that. The only thing I need to touch upon is certainly that all of these listed criteria have to be fulfilled and to be evaluated. So it is our target and our aim to really scrutinize all available data with respect to their reliability and relevance, and then to base our evaluation on it. So how do we want to get there? So this is actually a relatively short slide with little text, but it is very crucial with respect to the question how data rich is the substance, etc. We started with what we call here background documents, so the regulatory documents that Tim and colleagues already mentioned, so the Annex 15 dossier on OPnEO, on octalphenol, and we also considered nonalphenol, of course, in a group approach. In the end, we decided that octalphenol itself is or can be expected to be data-rich enough in order not to rely on a read-across approach to a related substance, at least not in terms of quantitative risk assessment, but certainly any mechanistic similarities need to be taken into account, and that's what we also do. When you read worst case approach, what's the worst case approach here? It has to do with the degradation pattern of OPnEO, and that it breaks down during biological degradation into shorter chain ethoxylated octalphenols, into carboxylates, and then finally into octalphenol, so the substance that has actually led to inclusion of OPnEO into Annex 14 due to its undoubted endocrine disrupting properties. The Annex 15 dossier for octalphenol was released in 2011, so this is already some years ago. And therefore, we started, first of all, certainly by reviewing the background documents, but searching for literature that has been released since that date. And we came out looking for relatively low and well-defined number of search terms like octalphenol, nonalphenol, all the acronyms that are involved, alkylphenol, estrogen activity, and similar search terms. We came out with 1,400 hits. Certainly much of this was related to analytics, pure chemistry, etc., not necessarily everything with ecotoxicity. So we made a pre-selection and could boil down this first list of hits to approximately 100 to 150 documents that were apparently still relevant. And then further selected this by excluding apparently unreliable studies that were only available in Japanese or Chinese, so not even an abstract in English. Certainly studies investigating organisms that are known to have no endocrine system, like algae. The final result was 41 studies that we considered to be relevant. We still further scrutinized them in terms of reliability according to Klimisch scores, used the Toxa tool that Annika already mentioned, and also evaluated their relevance. What may be non-relevant? You could imagine that the route of exposure may not be appropriate when you think about intraperitoneal administration. This is something that will not contribute to a PNEC, so an external concentration that has endocrine effects. We then allocated the studies to the OECD level scheme that is certainly known to you. I can relatively briefly go over that, but in terms of relevance, certainly the OECD level 4 and 5 data will be the most relevant ones because they consider the whole organism. They investigate apical endpoints, but certainly also the lower levels are relevant because they allow establishing something like an AOP, or at least a link between an endocrine effect on a molecular or cellular level and the whole organism. So the taxonomic groups that were identified, that's not a surprise. It's very similar to the regulatory background documents, are fish, invertebrates, amphibians. And on OECD level 3, there is information available on effects on biomarkers or gene expression, so the famous vitellogenin in fish, but also some apical endpoints were investigated in those studies, like fertility, reproduction, but over a shorter exposure period. So nothing that is really valuable for establishing a PNEC for long-term effects. The situation is, well, relatively similar on OECD level 4 for octalphenol. We have fish, invertebrates, amphibians, and what you can see here is the most significant gap for invertebrates in that there is no study really available that indicates the nature, the mechanism of the endocrine activity, as compared to fish, for instance, where vitellogenin induction and test is over clearly shows that there is an endocrine mode of action, whereas for invertebrates there is not much that is of similar value. And also in amphibians, we have mechanistic data that allow establishing an endocrine mechanism. And also the apical endpoints that are addressed are fairly complete. We have developmental endpoints in fish, like weight and body length, sex ratio, and in amphibians, growth and timing of larval development and sexual development. And data becomes certainly less at OECD level 5 because these studies are typically characterized as studying the organisms over several generations, or at least over a full life cycle. Such studies are available for fish, mostly freshwater species, and in one case an invertebrate, which is a marine copepod, Tigriopus, but not for amphibians. This stops at OECD 4 level. These studies also often measure biomarkers and other indications of hormone activity, and as apical endpoints, most frequently reproductive parameters like fertility, the number of eggs in fish, or the fecundity of invertebrates. So, as already mentioned previously by my colleagues, the adverse outcome pathway, or linking endocrine effects at cellular or molecular level to really vital functions of an organism and population-relevant endpoints is an important prerequisite for performing a risk assessment. Otherwise, you could not really establish if the effects that you see at organism level are linked to an endocrine activity. This could be general toxicity as well. And this certainly contributes to the reduction of uncertainties in decision making. And in this case, we have a clear adverse outcome pathway for fish. And I wouldn't claim this is equivalently the case for amphibians, but at least we have very good indications of the hormonal cascade that is involved, which is the it's the HPT. I cannot currently really speak it. Anne-Geike already mentioned the pituitary gonadal axis. So this influences larval development in amphibians. So this is an additional mechanism that has been identified in addition to that identified in fish. We then also had a look at the question if there are indications of a non-monotonic dose-response curve in octalphenol. And we identified one single study that at least suggested some kind of U-shaped NMDR, so something that might indicate low-dose effects. But this was related to vitellogenin induction only, so just a molecular effect. No other endpoints showed such a pattern. This finding was not reproduced by any other of the studies that we considered in the database, in the same concentration range and employing very similar methods and exposure patterns. So you might ask, is this just an artifact or not? Anyway, we certainly need to take this into account as in a weight of evidence approach and come to a conclusion also considering such a finding on a lower level of information integration. There were also other cases of NMDR reported, but just not a U-shape, but what is in the literature frequently called an inverted U-shape, or you could call it an N-shape. So first increasing effects with increasing concentration, but still higher concentrations, decreasing effects again. And this is a very good indication, actually, if concentrations were sufficiently low. Also an important aspect always, as repeatedly highlighted during today's session. If this is the case, that concentrations are sufficiently low, then it is quite unlikely that low-dose effects are missed. But that's certainly also something that needs to be placed into context, at which concentrations can effects actually be expected. In the end, there's little or no evidence that either non-monotonic dose response or low-dose effects play a major role. That's a preliminary conclusion, certainly, because we are still in the process of further evaluating the data. And the next steps will be to decide, first of all, do we need further tests for organisms that are currently not sufficiently addressed? Further evaluate the data regarding the relevance and robustness, and then go forward with deciding, is there a threshold or a basis for PNEC derivation or not? This is also known to you. There are basically two approaches for deriving a PNEC, either by applying an assessment factor on the lowest relevant NOEC, or by calculating a species sensitivity distribution and identifying the 5th percentile among the species tested. There are, however, further prerequisites, and we are currently not finally sure if octalphenol is data-rich enough to apply an SSD, because according to ECHA guidance, you would need at least 10 reliable NOC values from at least 8 taxonomic groups to derive an SSD. Despite the data richness, there are certainly further uncertainties associated with this, because SSDs calculated previously also relied partly on read across, and we are certainly now in the situation of deciding, do we fully consider read across from, for instance, non-alphenol, or only restrict our evaluation to data on octalphenol itself. It's a cutting edge in the end, and it may, however, not really influence the actual outcome, because we have seen that the database is relatively similar, and despite the differences identified in the Water Framework Directive, also PNECs might be expected to be relatively similar. That's certainly also something that still needs to be taken into account. So that's the state of play. We have still a long journey in front of us, and yeah, we will certainly report back at some point in time before applying for authorization. Thank you very much.